I want to start our conversation today by speaking directly to you. And I want to ask you a quiet question, a question you've likely never said out loud, maybe not even to yourself as you've gotten older. Have you ever asked, is it still okay that I do this? Not out of guilt, not out of shame, just a genuine question that lingers in the silence of your own mind. If you know that feeling, I need you to know this first. You are not alone. Thousands of men over 60 carry that exact same question, wondering if the natural, private part of their lives has somehow become wrong or even harmful with age. Welcome to the Essential Health Podcast. My name's Dr. Anya. I'm a physician, and for over 2 decades, I've had the privilege of having the confidential conversations with my male patients that so often get ignored. We talk openly about blood pressure, cholesterol, even testosterone. But when it comes to the topic of self-touch, of masturbation, there's hesitation, there's confusion, and there is a profound lack of good, clear medical guidance. And that silence is dangerous because what happens when there's a void of information? It gets filled with fear, it gets filled with myths, and men start to worry that the technique they've used for 40 years is now silently working against their health. Today, we are going to fix that. We are going to replace the myths with medicine. We are going to have the conversation your doctor may have never started. I am going to walk you through, as a physician, how to adapt your self-touch routine for a body over 60 in a way that protects you, respects its changes, and supports your pleasure and your health for years to come. Here's my promise to you for this episode. First, we will understand the 3 major biological shifts in your hormones, your circulation, and your nerves that are changing the rules of the game. This will give you a profound sense of relief. Then I will expose the 5 silent mistakes that most older men make, mistakes that can lead to discomfort, desensitization, and frustration. And after that, I will give you my 7-step, doctor-approved technique for a safer, more mindful, and more pleasurable experience. And this is why you must stay with me until the very end, I will give you the 4 clear, undeniable red flags, the warning signs that tell you when a change you're experiencing is no longer normal aging and it is absolutely time to seek medical help from a urologist. Knowing the difference could be one of the most important things you learn this year. This is not a conversation about shame. This is a conversation about your health. Let's begin by understanding what has really changed inside your body. All right, before we can even begin to talk about a new technique, we have to start in the most important place. We have to understand the new body we are inhabiting. So many of the men I speak with are carrying a heavy burden of surprise, confusion, and frankly, shame because their bodies no longer respond the way they used to. They feel like something is broken, like they have failed. So the first thing I want to do is lift that burden from your shoulders. Let me reassure you with all my medical authority. This is not dysfunction. It is biology. What you are experiencing is a series of normal, predictable, and manageable shifts. Let's walk through the 3 major system changes that are rewriting the rules. The first is hormonal. The most well-known change is the gradual decline in testosterone. We think of testosterone as the performance hormone, but it's more accurate to think of it as the spontaneity hormone. When you were younger, desire could be like a lightning strike, instant and powerful. As testosterone declines, that doesn't mean your desire disappears completely.
It simply means that it often needs a more conscious, more deliberate invitation. It shifts from being a reflex to being a choice. That is a normal, natural evolution. The second major shift is circulatory. The intricate network of small blood vessels that supply the penis and are responsible for an erection naturally become less elastic and less efficient as we age. This is a simple mechanical reality, like an old rubber band that doesn't snap back as quickly as it used to. What does this mean for you, practically? It means that erections may be slower to build. They may require more consistent and direct stimulation, and they may be more difficult to maintain, especially if you are distracted or stressed. It's not a sign that things are broken. It's a sign that the system just needs more time and more focused, gentle support to do its job. Patience, not pressure, becomes your greatest ally. And this brings us to the third, and perhaps the most subtle and misunderstood shift. It is neurological. The nerve endings that once reacted instantly to the slightest touch can become a little quieter with age. The sensations may feel more muted. The signal may take a fraction of a second longer to travel from the point of touch to the pleasure centers in your brain. And here is where so many men make their first critical mistake. They interpret this quieter signal as a problem. They think they need to shout louder. They push harder. They grip firmer. They go faster, thinking that will somehow bring the old feeling back. But what they are actually doing is overwhelming the system. You are shouting at a nervous system that is asking you to whisper. It can't register the signal because there is too much noise. The pleasure feels flat, not because the nerve is dead, but because the technique is wrong. So, let's put it all together. Your desire needs a more conscious invitation. Your circulation needs more time and patience. And your nerves need a gentler, more focused touch. The methods you relied on in your 20s, 30s, and even 50s, the habits that were built over decades, may no longer be serving the body you have today. And that is not your fault. It is not a failure. It simply means that it is time to update your technique.
Okay, we now understand the new biology. We have a body that needs more patience, more conscious intention, and a gentler touch. Unfortunately, most older men were never taught this. They assume something is wrong with them, and in their frustration, they double down on the old methods. They push harder. And in my clinical experience, this leads to 5 silent mistakes. 5 habits that are not only ineffective, but can actually cause discomfort, desensitization, and long-term harm. We are now going to open the case file on each one, and I'm going to give you the doctor's prescription to fix it. Mistake number 1 is using the same grip strength you've always used. After 60, due to hormonal changes, the skin of the penis becomes thinner and more sensitive to friction. A grip that used to feel pleasurable might now feel irritating or even slightly painful. A persistently strong grip can, over time, damage the small, delicate blood vessels and desensitize the very nerve endings you're trying to stimulate. You are essentially teaching your nerves to ignore the signal. The prescription is simple. Loosen your grip. Consciously relax your hand. The goal is no longer force. The goal is sensation. Think of it as holding a precious object, not crushing a can. This one change can be a revelation. Mistake number 2 is going too fast, too soon. Remember, your nervous system is a little quieter now. It needs more time to process the signals. Fast, aggressive motion can overwhelm it. The brain literally can't register the sensations fast enough, so pleasure can feel flat, muted, or just confusing. You're moving faster than your nerves can feel. The prescription is slow down.
Think of your body like a radio that is now tuned to a slightly different frequency. The music is still there, but your tuning needs to be more precise, more deliberate. Experiment with slower, steadier, more rhythmic movements. Allow your brain the time it needs to catch up, process the sensations, and translate them into pleasure. Mistake number 3 is skipping lubrication. There is a deeply ingrained myth that lubricant is only for partnered sex or only for women. That is biologically false. As testosterone drops, natural pre-ejaculate lubrication decreases in men as well. When you combine that with thinner, more sensitive skin, dry stimulation becomes actively risky. It dramatically increases friction, which can cause invisible micro tears in the skin, leading to rashes, irritation, or a delayed soreness the next day. The prescription is use lubricant, and use it early. Apply a gentle, unscented, water-based lubricant before you even feel fully aroused. This is not a sign of failure. It is an act of intelligence. It allows your skin to soften and respond, and it helps your nervous system interpret every touch as pleasurable and safe, not as stressful and abrasive. Mistake number 4, and this is a profound one, is forcing yourself to climax. For so many men, climax is seen as the only measure of a successful experience. After 60, that is a recipe for frustration. Your body will take longer. Your arousal will naturally come in waves. It will ebb and flow. That is not a failure. It is a new rhythm. The harder you try to force pleasure, the more you activate your fight or flight nervous system. You release stress hormones that are the chemical opposite of arousal. They are an emergency brake for pleasure. The prescription is let go of the stopwatch, let go of the goal. If your body needs a pause, take a pause. If you feel satisfied and connected before climax, allow that to be a complete and valid experience. Your worth is not measured by whether you reach a finish line. The final mistake is ignoring your body's signals and simply going on autopilot. After decades of routine, it's easy to just repeat the same pattern. But self-touch after 60 is no longer about repetition. It is about response. It is a conversation. The prescription is pay attention. Listen to your body. If something feels dull, change the pressure. Change the rhythm. If something feels uncomfortable, stop. If a different, unexpected area suddenly feels good, stay with it. Explore it. You are no longer performing a task you've memorized. You are on a journey of rediscovery. You are connecting with the body you have today, not the body you had at 20. When you fix these 5 mistakes, you create the foundation for a much safer, healthier, and more satisfying experience. But what does that new technique actually look like, step by step? We'll get to that right after this. All right, we have just deconstructed the 5 silent mistakes, the old habits that are no longer serving you. We've cleared the slate. So, now I want to build a new foundation, a new approach. I don't want you to think of this as a technique. I want you to think of this as a practice of mindful, conscious self-touch. This is not about chasing a goal. It is about reconnecting with your body and discovering what feels good now. I am going to walk you through a 7-step guide, a doctor-approved ritual for a safer, healthier, and more deeply satisfying experience after 60. Step 1. Choose your moment. This is the most overlooked step. Do not rush. Do not try to fit this into a stressful 5-minute window before you run out the door. You must consciously block out at least 15 to 20 minutes where you know you will not be interrupted. You are creating a container of safety.
Your nervous system cannot relax and allow pleasure if it is on high alert, listening for a knock at the door. Choose your moment with intention. Step 2. Set the environment. Your environment sends powerful signals to your brain. A harsh, bright overhead light is a signal for alertness, not arousal. A cold room creates tension. Create a space of comfort. Dim the lighting. Perhaps light a candle. If it helps you, put on some soft instrumental background music. Comfort is the absolute foundation of pleasure. Step 3. Start with your breath. This is non-negotiable. Before you touch your body at all, I want you to simply lie back, close your eyes, and take 5 slow, deep breaths. In through your nose for a count of 4, and out slowly through your mouth for a count of 6. A longer exhale is a direct message to your nervous system. You are telling your body, I am safe. I am present. I am not in a rush. You are shifting your entire physiology out of fight or flight and into a state of rest and receive. Step 4. Apply lubricant early. This is a profound shift in mindset. Lubricant is not a fix for a problem. It is the first step of the invitation. Apply a gentle, unscented, water-based lubricant, not as an afterthought, but as the very first act of touch. Gently rub it across your entire genital area. Allow the warmth of your hands, the moisture of the lubricant, and the act of gentle touch to become part of the process itself, not just the setup for it. Step 5. Explore slowly. Do not go straight to the most sensitive areas. Do not begin with the old, goal-oriented motion. Think of this as a massage, not a machine. You are exploring. Use a lighter touch than you're used to. Explore different pressures, different rhythms. Use different parts of your hand. Discover what your body, the body you have today, is actually asking for. You may be surprised to find that a sensation you've ignored for 50 years is now the one that brings you the most pleasure. Step 6. Pause when needed. This is an act of deep self-respect. In the new rhythm of a body over 60, arousal will come in waves. It will ebb and flow. If you feel your arousal starting to fade, that is okay. It is a signal to pause. Return to your breath. The goal is not to frantically chase the feeling. The goal is to allow it to unfold. It may return or it may not. The practice itself is the success, not the outcome. And step 7, breathe throughout. Your breath is your greatest tool. When we focus intensely on a goal, we tend to hold our breath. This creates tension and restricts blood flow, the exact opposite of what you want. Throughout this entire practice, keep returning your awareness to your breath. A slow, steady breath is what keeps your blood flowing, keeps your nervous system relaxed, and keeps you tuned into sensation. This entire practice may feel unfamiliar at first. It is slower, it is quieter, it is more mindful. But for so many men, this conscious, pressure-free approach opens the door to a deeper, more grounded, and more meaningful satisfaction than they have felt in years. That 7-step guide is a beautiful and profound practice. It's a shift from a goal-oriented mindset to a sensation-oriented one. But there are a couple of final crucial layers to this conversation that I don't want us to miss. The first is something so simple that most men overlook it entirely: your physical position. Think about it. If you are sitting hunched forward in a hard chair, you could be physically compressing the delicate nerves and blood vessels in your pelvic region. You could be working against your own circulation without even realizing it. I want you to experiment. Try reclining with a supportive pillow behind your back. Try lying on your side.
For many men, simply elevating their legs slightly with a pillow underneath can dramatically improve blood flow and change the entire experience. Your posture matters. Create a position of openness and relaxation, not compression. And this brings us to the most important layer of all, your mindset. After 60, self-touch is no longer just about stimulation. It is about creating a safe space where your mind, your body, and your nervous system can reconnect without pressure, without guilt, and without shame. So many of the men I work with are still carrying a silent expectation in their minds that their bodies should look or feel or respond a certain way, the way they did at 30. They see the changes not as a natural evolution, but as a personal failure. But the truth is, what you are experiencing is not failure. It is a different kind of pleasure. It is often slower, softer, and more responsive to your presence than your performance. This is not a race. It is not a test. It is you tuning back into your body's unique language. And with time, you'll find that what your body is saying now is different than what it used to say. But it is no less worthy of being listened to with patience and with kindness. And now for the promise I made at the very beginning. While all of these changes are natural, sometimes your body sends a signal that is more than just evolution. Sometimes it's a warning sign. And knowing the difference is how you truly take care of yourself. Here are the 4 clear signs that it may be time to stop guessing and check in with a urologist. Number 1, persistent pain or discomfort. A mild sting from dryness that's fixed with lubricant is one thing, but a consistent burning feeling, soreness, or pain that doesn't go away could signal a minor infection, inflammation, or tissue irritation. These are almost always easily treatable, but they must be addressed. Number 2, sudden or ongoing numbness. A gradual, subtle decrease in sensation can be normal with age, but a sharp drop or a dead zone of feeling that wasn't there before could reflect a nerve-related issue that needs to be evaluated. The earlier it's caught, the better the outcome. Number 3, a complete inability to achieve an erection. If arousal was possible before, and now, even in a calm, private setting with no pressure, it feels impossible, this may signal an underlying blood flow or hormonal issue. This is not a reflection of your masculinity. Your vascular system is a system, and like any system, it may need a tune-up. And number 4, significant emotional distress. If you consistently feel anxious, ashamed, or profoundly frustrated during or after self-touch, please don't ignore it. Emotional health and sexual function are deeply connected. Talking to a doctor is not a sign of weakness. It is a sign of profound commitment to your own well-being. And if you are unsure how even start that conversation, try these simple words. Doctor, I've noticed some changes in how my body responds during solo activity. Is this part of normal aging, or is it something I should keep an eye on? I promise you, any good provider will know exactly what you mean and will respond with the respect and the help you deserve.